Well, I grew up in northeast Louisiana, a small town in the Louisiana Delta called Newellton. My grandmother's from Jackson, so this is kind of like my second home. I went to undergrad at Belhaven for 2.5 years, then finished at Mississippi State, and then I went to took a year off, worked at a small hospital, just worked in the lab, physical therapy, trying to figure out what I wanted to do. Then I ended up going to LSU Medical School in New Orleans. After I completed my training in New Orleans, went to Huntsville, Alabama, to University of Alabama, Huntsville, and did my family medicine residency. I finished my residency in 2003, and I practiced from 2003 to 2011 in northeast Mississippi, in a small town, Pontotoc and Ecru. I don't know if you're familiar with those areas, but and then came down here in 2011 and joined Premier Medical Group. The reason I chose family medicine was I really enjoyed all the different fields. I enjoyed women's health, I enjoyed children, adult medicine, and geriatric medicine. And I felt like family medicine would allow me to treat a variety of patients. Also, I grew up in a small town, and so I felt like there's a big need for primary care, and I wanted to be, that's what I wanted to do. I enjoyed it all, and I really couldn't pick one particular field, so I said I'll try to do a little bit of all of it, so that's why I chose family medicine. My philosophy for patient care is, my overriding theme is basically I want to treat that patient like I would want to be treated if I was sitting across from myself in the exam room. I want to give that patient the best care. I also, I think one of the biggest factors for a successful relationship between a physician and a patient is for me getting to know this patient. And the biggest part of that is me listening to you, kind of hearing what's on your mind. A couple things about me personally. I grew up in a small town. I love deer hunting. I don't get to do it much since I'm a physician. I grew up in a big family. I was one of 11 kids, and so I really appreciate that, just the whole family. And so other things, I have 5 kids, and so I'm not going to retire anytime soon. My patients say, "Are you retiring?" I said, "No, I got to work a long time for these 5 kids." You know, I'll tell you my biggest mission is that, you know, I'm a believer in Jesus Christ, and I feel like I'm going to give account for all that I do, even my practice. And one thing that I'm called to is that I see every patient as, hey, this is a patient that's created in God's image, special. I need to give the utmost care, respect, and they're looking at me they're actually putting their health in my hands, and I don't take that lightly. And like I said, I want to treat them like I want to be treated. And so that's kind of my philosophy in practice.